In today's video, I'm going to show you what happens when you have uncontrolled acid reflux that leads to a condition called Barrett's esophagus and unfortunately esophageal cancer. Howdy, I'm Dr. Islam, board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with all sorts of reflux issues. You have reflux or you have issues going on inside your esophagus, come see us. We can find out what's going on, get down to the root cause, and get you feeling better. So in this case, we have a 65-year-old man coming to see me who's had chronic reflux for a long time. It was not causing him a lot of issues. He didn't think about it. It wasn't causing him a big deal. But what he noticed recently is that he was having trouble swallowing. Food was getting stuck as it was going down the esophagus. This is a very new symptom, and his wife was concerned because, hey, it's kind of weird. Why are things getting stuck? So he came to see me mainly because he was having issues with things getting stuck. Now, in his history, we talked about kind of what was going on, and he mentioned to me that he's had reflux for a long time, but it's never been a significant issue for him. Intermittent, off and on, but he was having this issue. So because he was having difficulty with things getting stuck, I told him the most common reason why things get stuck is a narrowing that esophagus called a stricture. Very common reason, usually due to acid reflux. The most concerning thing, however, is something more ominous, like a cancer in that esophagus. So we did an upper endoscopy, and lo and behold, unfortunately, we did find an esophageal cancer in the esophagus. In this video right here, you can see there is a large 5-centimeter mass in the esophagus right there. In the same setting, you can see the reason why. There are some cells that are there that are very consistent with a condition called Barrett's esophagus. So Barrett's esophagus is a precancerous lesion from chronic acid reflux. And the problem with Barrett's esophagus is that over time, it does lead to esophageal cancer. In this case, unfortunately, this patient was diagnosed with esophageal adenocarcinoma in the setting of Barrett's esophagus. So what should you know? So number one, acid reflux is not something to ignore. Even those who are young, chronic acid reflux can lead to significant damage down the road. Number two, you don't have to have rip-roaring reflux to have worsening issues down the road. In fact, the most common presentation, unfortunately, for individuals with Barrett's esophagus and esophageal cancer are typically intermittent reflux comes and goes, and it usually occurs in middle-aged Caucasian men. Number three, there are risk factors for developing esophageal cancer: smoking, being overweight, not exercising, drinking alcohol. But the biggest risk factor is acid reflux. So if you have any acid reflux whatsoever, come see us. We can see what's going on. And then lastly, difficulty swallowing is not normal. I cannot tell you how many patients think this is normal. It is not. If this is you, come see us immediately. We can find out what's going on and make sure you're doing okay.